Welcome back, everybody. So a recent Harris Poll survey found that nearly 75% of Texans are worried that the worker shortage in healthcare could have an impact on their own health. So joining us now to discuss is the Director at Large of the AAPA Board of Directors, Mr. Eric Martinez. Thanks so much for waking up with us.
Of course, thanks for having me.
So healthcare is nothing to mess around with. So how is this worker shortage in healthcare impacting Texans' our access to care?
Yeah, it's definitely having an impact. And just to share a quick personal story with you, I had to get annual eye exams, and my last appointment almost took me 6 months to get. And I know other patients are just as frustrated. In fact, 3/4 of Texans surveyed are saying that the healthcare system just really isn't meeting their needs.
Yeah, it's ridiculous. I'm with you on getting those appointments. Can you discuss some of the additional findings from this recent Harris Poll survey?
So two big barriers that patients face when they try to access care. One is the rising cost of healthcare, and the other is really just long wait times. So in fact, 1/3 of patients say that they've been financially strained by a recent healthcare increase in cost, which is about 10% higher than the national average. And 50% of Texans say they've actually skipped or delayed care in the past 2 years. And I work in the ER. Unfortunately, that's when I see a lot of patients come in for illnesses that really could have been prevented if they had good access to primary care.
Well, I know a lot of times I can't get in with my actual doctor, but how can these physician associates or PAs help alleviate some of these issues? Because oftentimes I'll see the PA.
Yeah, so the PA profession is one of the fastest growing healthcare professions. There's about 168,000 PAs practicing nationally, and we have about 11,000 here in Texas. And the data really overwhelmingly shows that when patients have access to PAs, they have better outcomes and they have shorter wait times.
And are there any other obstacles that are making the care shortage more severe?
So state laws vary practice laws vary from state to state. And unfortunately, a lot of these laws are outdated and don't really reflect how care is currently delivered. For example, again, as I mentioned, I work in the ER. So there's certain medications that I can give you while you're under my care in the emergency department, but then I can't prescribe for you when you go home. I recently got a chance to go to DC and advocate for some national priorities we have. And one thing that PAs are trying to do currently in Congress is get PAs added to federal workman's comp insurance. So if you're a federal employee, say if you're a Border Patrol agent or a postal worker and you get injured at home, you could come see me and I could treat you. However, if that was an on-the-job injury, unfortunately, PAs aren't covered by federal workman's comp, so you wouldn't be allowed to see a PA.
Oh, okay. Well, where can people go for more information? There's a lot to digest.
So I truly believe that PAs, we go beyond for our patients, and that's really reflected in this data from the Harris Poll. So if you want to know more, you can go to aapa.org/patient experience.
Well, thank you for the work that you're doing. I really appreciate you.